Welcome, everyone. We are so thrilled to have you participating in this session today. My name is Carly Roner, and we'll go through and do introductions here in a minute, but we are so thankful to have you all in our session supporting students, SANE services, and partnerships here on campuses across the state of Oregon. I wanted to let folks know that we are continually grateful to our funders for being able to fund part of this presentation today through the Office of Violence Against Women, U.S. Department of Justice. And also wanted to let folks know that the information that's going to be presented today in this session is not intended to serve as legal advice, though it's very important. Nobody wants Kelly or I to serve as your lawyers. So we really encourage folks to reach out to your legal counsel if you have questions about how to do this work or how it might apply to your situation and working with survivors across Oregon. And if you have any questions, also please feel welcome to reach out to us. We'll have our emails up here in just a few minutes. So welcome. We are so, like I said, thankful to have you all participating with us today. I'm thrilled to be joined by Kelly. Kelly, do you want to introduce yourself for folks?
Yes, I'm so glad you all took the time to attend this session. My name is Kelly Kendall. I'm a family nurse practitioner, and I currently practice at Oregon State University Student Health Services. I provide general medical care as well as reproductive health care. And since 2008, I've also provided SANE services to our student survivors who present for care here at our clinic. I feel like this work has just added so much to my practice. I also feel very passionate that students and certainly all survivors have access to good medical services following such a traumatic, difficult experience that I could only imagine.
Yeah, thank you so much, Kelly. And we're so, I think, grateful to be able to work with folks like you who are supporting our students on college campuses. My name, like I said, is Carly Roner. I use she, her pronouns, and I'm the campus coordinator at SATF. And one of my roles in our campus program is to work with folks like Kelly to help think about how can we make sure that our compliance efforts on campus, so Title IX and some of the other regulations that we have, are really making sure that the way we're implementing those is student focused and not harmful. So bringing a trauma-informed approach to our care for students through compliance work and working with practitioners like Kelly and others on campus really helps us to be able to provide not only wraparound services to survivors, but also more broadly look at prevention efforts and ways that we can involve those staff and community members to make sure our efforts are really robust and helping to support our campus communities to be healthy and free from violence. I'm also joined in the campus program by my colleague, Aislinn Addington, who is our campus advocate coordinator. You all will be able to meet Aislinn coming up later in our live Q&A, which we'll talk about again at the end of this session. So I've shared Aislinn's information here on the screen, and I encourage you that if you are a SANE or a campus-based advocate or a community advocate, that you reach out to Aislinn via email so that she can help support you all in the work that you're doing on campus. So with that being said, here's where we are going to be heading today during our session. We want to talk a little bit about what might it be like for a student who is going through a SANE exam process on a college campus? What is that clinical experience going to be like? So Kelly's going to help walk us through that, as well as some of the needs that arise for students when they are presenting after a sexual assault or other type of interpersonal violence that requires medical interventions. So thinking about that and some of the additional privacy considerations that will come up. Oftentimes our students have a lot of varying concerns, and because of the context of our colleges and universities in terms of regulations and other policies, they might have some different privacy concerns or considerations. So we'll talk a little bit about that. We are also then going to pair that with the campus context and talk a little bit about how can schools support the needs of our student survivors. How can SANEs be better integrated in those campus, both prevention and response efforts to make sure that, again, student survivors are supported and that our response and prevention work is really robust and including that medical perspective, And then we'll finish up on how community partners might be able to find resources on campus. Sometimes it can be really difficult to navigate where support resources are, especially because all of our schools are so different. And so Kelly and I will be pairing up today to help walk you through not only that experience for a student survivor, but then how are some of the ways that you can navigate the college and university context as well. So with that being said, I'm going to pass it over to Kelly to talk a little bit about our SANE services on campus in that context.
All right. Well, so to begin with, you know, campuses are so different across the state of Oregon. So, you know, how things look on one campus that has SANE service will be different probably to another campus in terms of resources that are available both for the medical provider as well as within the campus community. So certainly knowing your particular community and the campus sort of presence is going to make a difference in what's available to student survivors. And certainly health services are very different from campus to campus. Some are quite small and others are quite robust, which also will impact sort of the ability of a campus to even offer a SANE service, quite frankly. So, but to dive in a little bit more deeply, you wouldn't mind advancing. Just in comparison, some things that are very similar to a SANE visit that a student might have if they were to present in a local ER versus to go to their health center for care. We are certainly going to go through sort of a standard triage process with that student. And just to take a step back, in terms of the training that SANEs get, the training is going to be similar regardless of the setting that people work in. We've all undergone a proficiency training program and are committed to providing care that follows the Oregon medical guidelines for sexual assault evaluation. We're really committed and passionate about the sort of trauma-informed patient-centered care approach that our training has just embedded in us. So that is going to be similar regardless of the setting. So yeah, just in terms of the triage piece, that's really, really important because it is very possible that in that initial triage with a survivor who presents, we're going to identify an injury or some circumstance that's going to actually require a higher level of care in order to fully evaluate and treat. So that is a situation where we will unfortunately needing to be arranging for that student survivor to be transported to a local ER, so those can be assessed first. Because again, patient safety and need for urgent medical care is always going to take priority over the provision of any additional SANE services. Having said that, that's not that common, I would say. I can think of only a handful of situations where that's happened in my practice, fortunately. But again, something we definitely need to consider as that part of the initial evaluation. What else is a little different is how people present to us. It's not all that uncommon for folks to schedule an appointment or to come in for a kind of a nursing advice question. And in the course of that conversation, we find out kind of what's really behind that request is a sexual assault circumstance. So those are situations somewhat different in the ER where people may present maybe a little bit more acutely. Certainly I am aware of colleagues in the ER setting who say people come in for emergency contraception or sexually transmitted infection concerns, and the sexual assault history doesn't necessarily get brought to the forefront. So I think that's one thing that, at least in my particular work setting, we're very much attuned into asking questions in a way that's comfortable and certainly open-ended for folks to share or not to share as they prefer. So that presentation piece may be a little bit different from the ER. The other thing that is similar is all the options for care. So, you know, it may include the option for a SAFE exam, that sexual assault forensic exam, which is that kind of full head to toe evaluation where we're taking forensic samples or evidence and documenting that in order to have that survivor have that option of reporting and having some evidence to go along should they choose to do so. We're going to offer the option of an anonymous kit, or if the survivor has decided to go ahead and report to law enforcement, we can arrange for that kit to be transferred to that agency for follow-up via the crime lab. We're also going to make sure that they have the option of prophylactic antibiotic treatment for any sexually transmitted infections such as chlamydia, gonorrhea, and trichomoniasis. We'll be offering them the option of a prescription for antiretroviral medications to prevent HIV infection for any high-risk exposures that may have happened within the 72 hours exposure window. We're also going to provide emergency contraception medication, as well as really comprehensive discharge instructions that are going to include all our follow-up care recommendations, as well as information about how to access free counseling sessions that are also covered through the state funding that is available for these exams. So that's all across the board, very similar. And then in terms of the advocate involvement, certainly if we have a campus-based advocate available, that's going to be our first go-to person. But certainly in my setting, I'm always letting folks know that there is also off-campus advocacy, and certainly in our community, we have access to an off-campus SANE service. And for some survivors, that just makes more sense for them for whatever reason. So again, being that person who kind of lays out as many choices for that individual is a priority, and certainly the best type of care you can offer folks. Give them lots of choices, give them information, and make sure, of course, it's accurate information too. How we're different from the ER care has to do maybe with the timing of the services. And what I mean by that is we're not 24 hours, at least in our setting, and I can't imagine any student health service is, although that may be true across the country in other settings. But so unlike the ER, who's open 24 hours, people may present to us at a time of day where it's not going to be very possible for us to provide that care for them. And so we're going to be having a conversation with them about a soft handoff to the ER, and here's the reasons why. But on the other hand, it's been interesting. I've had situations where survivors present at 3 o'clock in the afternoon, and we have a conversation about services, and they're very clear about what they want and don't want, at least at that particular point in time. And they say, and I have to be at work in 2 hours, and there's no way I can miss work, or I have to be at this class in an hour, and there's no way I can miss that class. So just other life circumstances that are at that point a real barrier for them to proceed with any kind of a SANE exam. And so quite honestly, I do negotiate and be flexible with folks in those circumstances. We talk about the option of maybe coming back tomorrow for just, this, and this that they want. But I always tell them, if anything changes middle of the night, here's where I want you to go. I never want somebody to have regrets or not to feel like they have another resource for them, because timing can be critical, of course, with these exams. But I think, again, that's part of giving people choices around the care. And for many people, it's going to make or break whether they're actually going to engage with any kind of service at all. So just another thing to keep in mind. And certainly any service on campus that's offering SANE care will want to sort of have some setup and guidelines around how do you manage those situations that are kind of near your closing time or weekends, things like that. You definitely want to make sure those protocols and policies are well thought of, so the rest of your staff kind of knows how to handle those too. The other thing that's going to be different is that we will certainly be having a conversation with our student survivor about the campus conduct process. It's not going to be extensive, and it will only sort of apply if the perpetrator is also a student, but that can be a really important resource for our student survivors, and one we want to be sure that they are aware of, in addition to reporting to law enforcement as an option. The other thing is just some understanding about their student status can make a difference in sort of the information we're providing to them. So, you know, we're all aware that events like these can just kind of rock the boat in people's lives and maybe impact other parts of their lives, whether it's work or academics. And so there may be situations where a student is already on probation for academic issues. They have an assault happen. It just kind of rocks the boat and throws things off. And, you know, academics are going to probably suffer as potentially, you know, sort of other issues that may be affected in their life in terms of sleep and even work status. And so we're going to be thinking about that and making sure that that student is understands that the advocates can really help them kind of navigate other things that are going to be impacted by this experience. Because to be quite honest, our goal as student healthcare providers is to help students stay in school and accomplish what they're trying to accomplish in terms of their academic work. So we really want to do whatever is possible to kind of even things out so there's less worry and stress around those other pieces of their life. So that would be kind of some key similarities and differences. We will have a little bit more of a conversation, I think, later on about some privacy concerns, but that is another piece that we'll be spending a little time with folks, making sure they understand who's confidential on our campus setting and who's not, and why that makes a difference. So maybe we can go to the next slide. So in terms of the survivor perspective, about why it might be really great to be seen in a student health service for their care. Certainly the accessibility is often number one. You know, we're on the campus, it's a familiar location, and generally easy to access. And quite honestly, friendly, welcoming setting that is generally pretty calm, unlike an ER setting, which may feel at times a little more chaotic. And you know, to be honest, there may be a longer wait time going through an ER setting. That's just the nature of those busy settings, and that's completely understandable. So being a little bit more accessible and sort of a less wait time. These students definitely take priority in our service as soon as we're identified. We have a very low threshold for clearing our provider schedule and making sure they have the time to fully address the care needs of that particular student. The flexibility I've already kind of alluded to in our previous conversation about sometimes the survivor says, you know, I really want to do this, but I can't do it now, and I can do it tomorrow, and I'll totally be back tomorrow. And so we just, you know, roll with it and do, again, whatever we can to sort of enhance the chance that they're going to engage and get good care. Again, with that caveat is they're always going to make sure that they have that alternate option in case they change their mind after they have left our door. Cost, well, it shouldn't be an issue in terms of that initial exam, which is covered through the SAFE Fund of Oregon. Again, that covers the cost of an exam, forensic evidence collection, medications, some counseling sessions, up to 7 days post-assault. That is all the same in our setting. But occasionally there are situations that arise medically where some additional lab testing might be recommended or some follow-up lab testing. And it's likely that the cost of those services will be a little less through a student health center. The other thing is that in our particular center, we've kind of made a commitment to making sure cost is never a barrier to our survivors for any follow-up testing. So we kind of have a little pocket of funds that we will utilize if we run into situations where the survivor just, for whatever reason, maybe privacy, does not want to utilize any personal insurance. You know, having this follow-up test is going to make a big difference in terms of their level of stress and ability to sleep at night. So that may or may not be an option in other health services, but always grateful to have that, at least in our setting. And then lastly, the individual may have already come into the clinic for other services, immunization, nurse visits, what have you. So they kind of know what the space is like. They may have actually seen me as a provider for other reasons, or have certainly seen my colleagues and found out these are nice people, they really care about us. And so just the ability to walk in a door and ask for care in a difficult situation, you know, that barrier may be much less. So, and that's certainly, I think, a big thing. It can be kind of scary to travel across the town to a big ER to get care, knowing again that those ER folks are fantastic as well. From the same perspective, what I have really appreciated is that it's possible that I already have some medical history on this individual, even if they've never walked through the door. Probably as part of their registration process, they filled out a health history form. I have some immunization history. All of that can kind of make things a little smoother in terms of my getting more history again, building on that history, and kind of having some additional guidance about kind of what specific care an individual is going to need. The other thing that may or may not be an option is the Paragard IUD for emergency contraception. That's not typically something that's available in an emergency room setting, although we do know it is the most effective emergency contraception, and there may be some patient situations or some other situations where that makes perfect sense. And it doesn't necessarily have to be done the very day we're seeing them. It could be planned for potentially. You know, there is sort of a time frame where you want to place a Paragard IUD in order for it to be effective for emergency contraception. But, you know, for some of our students, they're looking for long-term contraception anyways, or, you know, this really makes sense for them medically. So we can place it, prevent a pregnancy, and then remove it down the road. And then the other thing that I have really appreciated, and I think maybe our survivors do as well, is kind of setting up the follow-up care process from the get-go. So generally before somebody leaves my office, I've already scheduled a follow-up appointment in a couple of weeks. So we can just see them back, do a check-in, make sure things are going well, that nothing new has arisen. Always letting them know I'm happy to see them sooner or talk to them sooner if necessary. But you know, that's just in place. And I think that's just makes it easier, because sometimes, you know, if you leave a clinic and then you have to think about making another appointment, you know, calling back, that's just, you know, a little too much. So setting up that follow-up appointment is really helpful. The other thing I typically will do as part of my follow-up care plan is I will go ahead and pre-order all of the follow-up labs that are recommended in terms of follow-up HIV testing or syphilis testing, what have you. We put them in our system electronically. I let the survivor know, here's the week you want to just come into our lab. I just try to make it so easy. Whether or not they choose to show up, that's kind of on them at that point, but at least we've kind of smoothed out that process. And I can feel reassured that at least they know these are recommended, and we've made it easy for them to do that follow-up. So those are kind of the key things I wanted to share about advantages to survivors, but I guess also advantages to me as a provider. Let's take a look at the next slide. Yeah, so I did kind of allude to our sort of focus on the survivor as a student, and kind of sort of thinking about how the situation may impact their life as a student. But we also know that there's lots of other identities that our students bring with them, as we all do. And so listed here are some of the things that we're also going to be thinking about as we see this individual. Certainly in terms of the individual identities, the way I sort of think about that is I'm thinking about other places of support or places of safety within a community that this survivor might already be connected to, that will be helpful to kind of encourage, remind them of. Certainly, a lot of campuses have cultural centers that are very helpful resources for our students. So the other thing we're going to be thinking about is what is their housing situation, particularly if the perpetrator is within the same residence hall they're in. Obviously, that's something that we're going to want to address. And again, our campus advocates are fantastic about navigating that with our students. Immigration and visa status sometimes comes up, particularly if, again, this is a student whose academic status is a little bit in jeopardy for whatever reason, and now things are going to slip and slide potentially, and that may impact their student visa status or immigration status. So that's definitely something that other resources on campus are going to be really important to access. We've talked about academics, but the other thing that comes up is sometimes, again, if the perpetrator is a student and they're sharing classes, we're going to rely on our advocates to help navigate how that survivor can feel safe in the academic setting. And there's lots of remedies for that. Finances, again, that kind of relates to academic status and kind of the precariousness of that individual situation, because that may also impact student scholarships that they are getting for their academic work. You know, they're not things that I dwell on a lot as part of my interaction, but I'm thinking about it and I'm making sure that the individual in front of me has got some resources in hand, and that I'm also following up with them when I see them for that follow-up visit. Because sometimes the things aren't initially obvious, and then 2 weeks later we find out, oh boy, here we've got something that we really need to think about. And then things that are not listed here but are very common to any of our SANEs as we're working with survivors, whether it's an ER here, is safety planning. Huge issue, and we're certainly going to take some time along with our advocates to address any safety issues. I think that we didn't talk a little bit about athletics. Sometimes that isn't so much of an issue, but it may impact depending on the sport and the season. You know, if this is an individual who they're kind of in the middle of their big season and they've had, you know, sort of this traumatic circumstance, you know, there may be some conversation with their athletic trainers and coaches that will need to happen as well in order for them to continue to be successful in their athletic role as a student as well. All right, so let's head on to the next slide.
Yeah, so Kelly, I'm really grateful for that perspective too. And I think when you're queuing up about all of the different considerations that a student might be bringing into that appointment, where they might have a variety of different identities that they hold that will impact their care. They might have different concerns about housing and all of these things. One of the areas that I think both we as practitioners, but also students have a concern about is privacy and who might be able to know the information they're sharing with you, other concerns that they have around their privacy. And so we have compiled a couple of those that are most common, I think, that come up both in the context of a SANE or a SAFE exam, but also in a lot of other areas on campus. And so if you could speak to some of the ways that these have came up for you as a SANE working with college students, would love to hear about that.
Yeah, absolutely. Certainly the alcohol and other drug is a very common concern. I mean, we know, unfortunately, many sexual assaults may be drug facilitated, or there has been some use of alcohol or drugs voluntarily as well. So that is a huge concern and can be a barrier to proceeding with an exam or any kind of services. So, right up front, if I hear that, I just I'm very clear with people that there is an amnesty policy. We are far more concerned about this crime of sexual assault than we are about the fact that you're underage and using alcohol or other drugs. And really try to emphasize that we don't want that history to hold them back from any other care needs that they are feeling they want to engage in. So very, very important to address that right up front if that comes forward as part of that visit. Yeah, and then just kind of skipping to the bottom one, the conduct process. So the way that has been important for us to think about in terms of our SANE service is first of all, we definitely talk with our survivors about, who is confidential on campus. Any service they get through our student health is completely private, as well as through our counseling centers, as well as through our advocates. But that is different for other people on campus. And I don't belabor that as a SANE, but I mention it, and then I really rely on our advocates to help navigate that, because it's kind of a confusing conversation to have with somebody on top of everything else I'm going through. But mostly I really want to emphasize, hey, these are the confidential places, and what does that mean and look like? But the other thing I think to really think about is if this is a student who's going to go forward with well, I guess to step back, as part of that confidentiality piece, we say, look, the only reason way information that you've given me is going to be released is with your written consent, or if I get a court order, right? You've gone ahead and reported it. And here's what we will release, okay? It's different when you talk about the student conduct process that's so varied from campus to campus and state to state. And what we have set up in our particular setting is that if a student would like information to be released from our service to a campus conduct process, we ask that they actually physically come in to our clinic, and preferably with an advocate, and sit down with the person who manages our medical records and take a look at what we're releasing, because once it leaves us into the campus, that's moving from a HIPAA setting to a FERPA setting, and they're different. And I think our students really need to understand what that difference is, so they're clear about the potential implications of that. And I think there's the options of potentially redacting parts of what is released. I think that's all potentially negotiable. But I do think it is very, very, very important that we be cautious about releasing records to other than other health entity or a legal process outside of the campus conduct process. Yeah, so that is how our facility has chosen to proceed in terms of release of information. As far as the Clery reporting, that's not something that the survivor is initially involved in, but that is an obligation for us. So I, as a SANE, if I'm providing care for somebody, the way I fulfill my obligations to report under the Clery reporting laws is I send my medical director a message saying, hey, I saw an individual for care for an assault that happened on or off campus. It's very limited data I provide, but I'm usually getting information, did it happen on campus or off campus? I usually provide information about whether it was drug facilitated or not, and whether the perpetrator was known to be a student. So very limited information, no other details, and that fulfills my obligation, and kind of they funnel up to the next person who needs to know that information. So those are sort of some 3 potentially unique considerations for SANE providers on campus around privacy and reporting.
Yeah, thank you. Thank you so much for that, Kelly. And I think, like we're saying in this session, it can be confusing for a student to hear or to think about these, and it can often be really confusing for practitioners as well. And so I want to offer for folks that we know, especially in the realm of the student conduct process, Title IX, Clery, that those are not always the first area of training or areas that folks might get ongoing training in. And so if you have questions, we in the campus program are very happy to help walk folks through, hey, if we're trying to build a process similar to the one Kelly spoke about, where it's like, we want to review records with a student, how does that impact what kind of records the school needs? We're happy to walk folks through different options that we've seen on campuses across Oregon and in other states to be able to do that. Currently, so we are coming to you in the year 2021, currently the new Title IX regulations do allow for students that are participating in a Title IX conduct process to maintain some privacy over what types of records, they call them treatment records, are shared with a conduct process. So that practice of meeting with a student or meeting with a survivor to go over, here, what do you want from your treatment record to be shared with the conduct process or with that Title IX coordinator, is a great practice that we really encourage folks to think about how you can do that to help students navigate their privacy, what information they want to be shared more broadly. So I really appreciate that that's something that Kelly and her team are doing.
And certainly one last comment just to make is that, you know, certainly as far as confidentiality, we are still mandated reporters. So if any situation presents itself that falls under those mandated reporting processes, not to campuses, but to, you know, law enforcement, we obviously have to let our students know that. And I have encountered those situations. So always want to remember that.
Yeah, so important. And that's the other thing I think where an advocate can be really helpful in walking folks through how information is shared when, because we also think about when folks are in trauma, trying to keep all of this information can be really difficult in one setting. I'm trying to think about my own physical safety and health. I'm trying to think about reporting obligations now, all of these things. So having another person that can walk alongside them in addition to the same is going to be hopefully a really helpful resource for that student to be able to access. Thank you for that, Kelly. So we're going to, in my role, I think one of the things that I have really been grateful for in terms of my work with student health services and folks that are in a similar position to Kelly and her team is just, like I said, the amount of wraparound care that can happen for a student and having that touch point that allows them then to be able to access a greater variety of services on campus. Kelly, when you said earlier that sometimes your interaction with a student or the interaction of a healthcare provider with that student after an assault can really be the determining factor about if they are going to then reach out to another service, reach out to that identity-based resource center to get support, reach out to housing or law enforcement. It's just such a critical role that so many of our students, I think, will start with health or counseling services, and based off of that reaction or the reaction that they receive from an advocate, determine if they want to get more support going forward. So I think, like you said, that's absolutely crucial. And so when we try to think about, again, some of those resources that can help them, if they then get that warm reception for a SANE service, where else can we connect them to? Especially if you were thinking about like, I don't have all of this in-house, or I don't have all of this within my center. Where can folks get that care and that additional support? So want to just really quickly continue that conversation around privacy and confidentiality. Here are some of the places where there might be some difference within the campus community that you're working within. So I just want to highlight, like Kelly said, there are over 45 colleges and universities, including medical schools in Oregon, and all of them have some degrees of similarity. And there are some very big differences depending on the availability of resources. So those folks who may have to share a student's information include the Title IX or Student Conduct Office. Oftentimes that's information that is kept private, but it might have to be shared with investigators or other folks within that small team. So it's not going to be shared broadly to the campus community in most cases. Faculty and staff, depending on the campus that a student is attending, those folks may be tapped as what we now will call either required reporters or responsible employees, or those with authority to report. Title IX gives us a lot of interesting language around that. But really it means that in some campuses, faculty, so those who are teaching, and staff, so that includes folks who are support staff, clerical staff, administrative folks, all over campus that aren't in a teaching capacity, they may have to share any information that they hear or any disclosures that a student makes to them about an experience with violence to their Title IX coordinator. Some of those identity-based resource centers could fit within that. So I'm thinking places like our queer resource centers, our Black student centers, anywhere that is going to support a student based off of an identity that they hold. Depending on the campus, they may or may not have to share that information. So just want to highlight that for folks. And this can extend to disability or accessibility services. Again, we're going to keep disability information private. That is protected information, but If someone is working with, say, an interpreter or someone, and that comes up in a class setting, the school may have different rules about how that information is shared with the Title IX coordinator. So I always just like to share that with folks so everybody knows kind of these areas, like Kelly's saying, where's private, where might not be so private if a student goes to get help. And then we have our privileged folks where that information comes in, and unless it's in an aggregate reporting form, that's not going to go anywhere without the student's express written permission. So our medical counseling folks, our campus-based advocates and our community advocates are the same in that way. So both having legal privilege, legal services, and then again, some of our disability and accessibility service folks are able to do that as well. So just want folks to take a quick look at this list and think about, if you're working with a student, do you know contacts at any of these areas, any of these centers where you could share contact information with that student survivor or get them connected if they needed additional support? So to recap some of the things that Kelly was saying about what are the needs or experiences that students might be having where they need some additional support outside of the medical setting, here's some of the ones we had talked about: individual identities, their academics might be suffering, housing. There are a lot of different services available on campus in most communities to be able to address these needs. Even if the school is very small and does not have a lot of resources, they may have community contacts that can help support a variety of these areas. The other thing that I want to highlight for folks is that, again, those campus-based advocates, many of our schools are hiring or have MOUs to have an advocate on campus now. Those folks are excellent resources at making sure that a student's needs, both for basic living, housing, food, all of those kind of things are met, but also helping them to navigate additional reporting processes like law enforcement or Title IX. They can also help folks to look ahead into like academic success and prosperity. So just really want to highlight that if you are working in a medical setting and you have not had the opportunity to connect with either your campus-based advocate or your community-based advocacy resource centers, that you do that so that you can get that wraparound support for that student. And if you're having any kind of difficulty figuring out who those folks might be, SATF is very happy to help folks get connected with those services in your community. The other thing that I want to highlight for folks is that schools have a mandate to provide these what we call supportive measures. And those are measures that make sure that that student can still access their education free from violence. So Kelly said earlier, wow, advocates have all of these different ways to help provide remedy for a student that might be experiencing academic distress or really having a difficult time in their classes if the person who has harmed them is in that same class, or potentially it's a faculty member that they've experienced harm from. So when a student has reported to the school has to make sure that those needs are met. They have to be able to access classes in a safe manner. They have to be able to access their education. And so if you are running up against difficulties with that, I also encourage you to reach out to us. We provide free confidential technical assistance to anyone who's working on a college or university campus to be able to navigate how are ways that we can make sure students get the care that they need to be able to stay in school. So these supportive measures are required as a baseline for all students that are reporting through the Title IX process, and many schools extend them to students even if they aren't going to go through that reporting process as well. Students can also, in addition to advocates, have these needs met in a lot of different areas across both campus and the community. But thinking about campuses particularly, those identity-based resource centers for students who have identities that are really going to help both provide spaces of safety for them, but also culturally specific and responsive resources, these spaces can be really incredible for that. So if you are working in a community with a school that has what we call identity-based resource centers or something similar to that, that's going to be an incredible place to start. Oftentimes, like I said, they'll have very specific services or contacts to help students based on their cultural or social identities. And so thinking about that as a place of contact for students can be a really great place to start. That again might be your queer resource centers, your Asian Student Union, all of these different resource centers that a campus can have. The other area that I've seen some incredible partnerships, both between advocates and housing, but also our medical and counseling services, is our student residence life housing departments. Being a former residence life staff member, I can say one of my favorite things to do is to partner with both medical and counseling departments and advocates, because you can get that kind of wraparound care again that a student might need. That could be something like having designated spaces in university housing for folks who've experienced medical emergencies or sexual assault to have a safe place to stay. It could also mean that these housing entities work with local hotels to provide safe off-campus housing for free or no cost to that student. And so we've seen those partnerships in a lot of really incredible ways to support those housing needs for students. If that's something you're interested in, I really encourage you to reach out to myself or my colleague Aislinn, and we can chat a little bit more about how that's worked in different communities. International student services, Kelly had alluded to the fact that some folks might have interruptions in their visa status, or just might be having a difficult time post-assault navigating what this is going to be like. I'm in a different country than my country of origin, so how do I navigate the legal system here? How do I get an early plane ticket back home? That International Student Services Department, or whatever that might be called in your community, can also be an incredible resource. In addition to advocates, I think our advising offices can also be really incredible resources for students that are navigating academics. Also, your Title IX coordinator and student conduct offices can help students, again, to provide some of those supportive measures if the person who's harming them is creating a barrier for that student to access their academics in a safe and healthy way. Want to highlight again for folks that most of these resources that are going to be on this slide are not going to be, they are not going to be privileged or necessarily even confidential resources. And so just keeping that in mind if you're thinking about pairing students with any of these services. We've also seen incredible support from both student athlete liaisons. So some schools have a specific person who, when a student has a medical emergency or another emergency that's impacting their academics and their status as a student athlete, can help them navigate that. If you're in a community that doesn't have that, the coaching staff and certainly trainers can assist with that, in addition to the advocates and other folks on campus. So just want to highlight that if the student feels comfortable with those relationships, those might be a great area of support. In terms of finances, we've also worked with students to make sure they're accessing financial aid in a way that can help support them, sometimes through being able to stay in their academics, but also to plan for future expenses. And so thinking about that as another partnership. And again, there's certainly others depending on the need and circumstances. If you are working with a student and they've identified a need that they are having a really challenging time to meet with, I really recommend chatting with those advocates in your community. And if you are needing some support in that, reaching out to us at SATF, and we're happy to help connect you with folks. So we want to talk a little bit about how can we make sure that with all of the incredible support and services that SANES are providing with our survivors that are students, how can we make sure that that lens is really incorporated to make sure that the campus or college community is benefiting from that expertise? And so, Kelly, I would love to hear a little bit about your experience. How has that shown up for you in your work at Oregon State University? How are some of the ways that you've been able to be incorporated in that work?
Yeah, so certainly I really do think it has been helpful for me, and also I think helpful for other groups across campus for a SANE to be sort of a presence on various work groups. And so in the past, I've been a part of a group of people within our campus community who are working both to respond and prevent sexual violence, sort of kind of a higher level strategy group. I've also sat on our local SART team for Benton County for a number of years. Again, that's sort of that wider community perspective, but bringing the campus voice to that table has been really valuable in many, many ways. And then I think the other piece that has been really helpful is just within our health service, we have a work group that meets regularly. We're kind of constantly evaluating our service, make sure, you know, we're meeting high standards, we're doing peer review. The people we invite to that table also include our campus advocates. So that's a way of collaborating and kind of, again, getting the pulse of what's going on in their work. and how we can be good partners. So that has been an ongoing and very, very important piece to keep our services up to a high level of standard, and also to just have that communication with the direct providers. I've also done tabling for various events throughout my time at OSU, Sexual Assault Month, other events. That's always a super fun way to meet directly with students, and really, really enjoy those opportunities as well.
Yeah, that's incredible. And I think also ways that you've been able to be incorporated are ways that we really encourage those of you who are campus partners. So maybe you're not a SANE, but you're a campus-based advocate, or you're a prevention person, or you're a Title IX coordinator. As you are thinking about the many different systems that go into supporting students to be able to access their education in a way that's healthy and free from violence, these are all also incredible places to make sure that you're getting that same perspective, because so many times what we know is that SANEs are one of the places where we are going to be gathering what those needs are, what are students talking about in terms of the barriers that they're experiencing, how they want to stay in school, but also where is violence showing up in the community? What types of violence are we seeing within the context of health and counseling? Who is reporting that? Who feels safe to access medical services? So that lens is so incredible as a way to incorporate into our broader, not only response work, how do we support survivors, but also our prevention work. And so if you are a campus practitioner, I really encourage you to think about how you're pulling that medical perspective in. Also want to highlight for folks that if you are trying to do programming or outreach, having those folks, as they're able to work with your students in a setting that's maybe not a medical setting, can be a really incredible way to build rapport and trust. So one of my past roles was as a prevention and wellness coordinator in a student health and counseling center. And often we would tag team with that staff of medical providers to go out and talk about healthy sexuality, talk about what can we do to make sure that our bodies are healthy, what does consent look like, what does treatment for sexually transmitted infections look like. And so many times what we heard from students was it kind of demystified all of those topics, but it also gave them a connection point with that practitioner. So just if you are somebody coordinating any of those outreach events, any of those boards of programming, think about how you can incorporate your medical team. Again, thinking about they have very limited schedules because you're going to be treating patients, and how can we make sure that we have the opportunity to have more folks hear those voices and connect with those folks to build relationships. So really want to highlight that. The other thing that we want to do really quickly is just, if you are not somebody who works in a campus or community setting, or if you are and you're just like, I need to know where I can find those resources a little more easily, we want to help demystify that for you as well. So where are some of the places that, if you are a SANE or another person working within the medical context, how can you find support that a survivor might need? So the school website is going to be a great place to start. And I want to start with a caveat of those websites can be wild to navigate because there's so much that a student might need to know about financially, class schedule, clubs, student orgs, all the things. And this is one section. And so if you are looking for information about reporting, how does a student access the Title IX coordinator, that's all mandated to be on the school's website. Recommend that you can search Title IX or sexual misconduct, and that will most often pull up that information for you. If you're looking for the advocate, typing in advocate services or gender-based resource center, something along those lines can usually help get you to at least a department where folks could have that advocate information. And again, SATF is happy to help you connect with those folks. We've built relationships with the majority of our campus-based advocates and community advocates and can help pair you with those folks in your community. Kelly had a wonderful recommendation about checking in also if your school does have health services. Many of our schools do, but there's some schools that aren't able to provide medical services or counseling services on campus. If you work with a school that does, going to that web page in the broader school website and looking at what they have available, if you are not working as a SANE on campus, might be able to help pair that student either with those services or give you as a practitioner the ability to see like, okay, these are the types of services that school offers. They have these kinds of free prophylaxis or whatever else might be available through that webpage. So really recommend that folks reach out and build that connection prior to working with a student. But if you need to, you can check that website as well. Other areas that you might be able to find contact information or support resources usually are couched under the student support kind of tagline on a website. And so want to encourage you to look up that, or typing in confidential services. Many schools have separated out where students can go to safely talk about their experiences without having to report them. And they've identified those on their website. So really want to encourage folks to check those out. The other thing that I want to make sure folks know is that Oregon, a couple years back, passed a really progressive law to ensure that schools had to publish not only a student's rights in terms of going through a conduct process, but also all of their options for reporting and seeking confidential services. And that includes medical services. So each school is required to publish what we call a Senate Bill 759 document that outlines not only what resources are available on campus, so that could be a SANE provider, it could also be counseling services or something like that. Campus-based advocates would be included in that document, but it also has their policies and community resources. And so if you're a community provider and you want to be published in that, you can connect with your school. And again, we're happy to help facilitate that connection. But that is a great starting place if your school has an updated document. So really encourage folks to look that up. Oftentimes students will, or schools will have that listed as a notification of rights and options document on their website. Again, if you're having difficulty finding it, reach out to us and we're happy to assist with that. So really want to thank folks for your participation in this virtual summit. It is so fun to get to connect with you this way. And we will also be back live and virtually in person for a live Q&A on August 18th from 3 to 4 p.m. And that's where we'll be joined by our campus advocate coordinator, Izon Addington, as well. So just want to thank folks so much for spending time with Kelly and I today. If you have questions, we are both available to serve as resources to you. Kelly's email is listed up here through Oregon State University. My email is listed here to be able to contact me at SATS. And we're happy to help you navigate setting up these same programs to be able to better support students here in Oregon. So thank you for the incredible work that you do and for taking time to spend with us today. I appreciate it so much. Thanks all.
Thank you. Bye-bye.